Getting ready to sing?
I'm trying to, I'm trying to get my ums out. I a lot. Like, I go, well, I was talking and then and I like pause. I'm just trying not to do that. I gotta write myself a program or something.
You can sing.
I can, but I'm not going to.
Right, okay.
Not today.
Very good. We thought we would take a little time to go ahead and update you on where we're at. We're at day, 35, because it's Monday, right?
Right.
Day 35 since surgery.
5 weeks. Yeah. 5 weeks ago today was surgery.
Right.
And now we're far enough along that we have a plan for what's next.
Yeah.
So, what's next?
What's next? Well, we're going to participate in part of a clinical trial here over the next 2 weeks prior to our next steps. So that will involve going down for some appointments and doing some blood work and getting some treatments ahead of time.
Right.
And then we're going to jump into the radiation and chemo part. Before we do that, we've got some things we have to do though.
Right. So there's a whole prep process that goes with radiation and chemo and all the things that have to do with that. And we're kind of knee deep in that prep process. So getting everything ready for that. So the plan for treatment is 6 to 6.5 weeks of radiation. That will occur every day. And then
every business day.
Every business day. Apparently they used to do it every day and found that didn't work out well for anybody. So every business day, 5 days a week for 6 to 6.5 weeks. Really, it's number of treatments. So they're going to figure out what number of treatments you need to kill the most cancer in your body.
Correct.
And then concurrent to that, or at the same time, you will also receive chemotherapy once a week.
Correct.
So one day you'll do chemo and radiation, and then the other 4 days you'll just do radiation. So chemo takes about 90 minutes to infuse. So on chemo days you'll do that, and then radiation really only takes about 5 minutes. You only get about 5 minutes of radiation. It takes about 30 minutes to set up each time, because the purpose of radiation is that it's as specific as possible. So they'll do all kinds of mapping based on your body and your cancer, and all the scans that they've done so far, so that they hit exactly all the spots that they need to hit and they don't hit all the rest of the spots. So
yeah, you mentioned the mask. That's going to be part of our simulation day. We're going to go in and they're going to go in and map where everything is that they can see on the PET scan. And then there will also, as part of that prep, be talking to a dietitian. We'll also be talking to social services and
there's all kinds of things that have to happen that I don't even know that they're wonderful things, they're great things, and it's great to have a team that's sort of orchestrating all of that. But you have to have a dental visit.
Yes.
So that they can make sure, because this is really hard on teeth, and so dental cleanliness and dental preparation is all really important. In that process, you have to have dental trays made, because they want your mouth and tongue to be in the exact same spot every time you get radiation. So that has to occur. You'll have a swallow study so that they can see how you're swallowing now. We did a pre-screening for hearing, so that we had a baseline for hearing.
Right.
And then we do see dietitians and social services and counseling, and I think there's a couple of other things. There's certainly blood work. We did EKG today. They have to make sure everything is in place for your body to be as healthy as possible. We have a GI consult for a feeding tube that's upcoming. So lots of things that have to be put in place. And then the final piece of that is they will build a mask for you. So there'll be this sort of cage thing. You can look it up. They look really Halloween-y and cool. That holds your head and shoulders in place, so that when the radiation is delivered, that it's delivered to the same spot every time. So that holds everything kind of where they want it. So we will start that, we think, mid-November.
Yep.
Maybe
maybe early.
Maybe
Yeah.
depending on getting all of the pieces in place, but it's a big orchestration to get all those things.
And a little bit of a bummer, you know, we're going to be doing it around my birthday and then Thanksgiving and Christmas. So it's going to, you know, kind of be a little bit of a crappy holiday season here.
Yeah.
But it's a thing that we're grateful that we're able to do.
Yep.
And the way I look at it is we've got a map of what's going on in my body now. And so, you know, now we can know how to manage it the next 30 years and we'll be keeping track of it. So
Yep.
I'm happy for that. And just got to keep a positive attitude through this. I know that, you know, the results of looking at who's successful at this and who's not is relative to who's got the resilience to deal with it. And you'll see some of that stuff on our blog that we're working through.
Yeah.
So go take a peek out there.
Yeah. All right.
All right.
Next steps.
Let's do it.